In recent years, 3D printing technology has been extended to the medical field. Printing patients' organs can achieve actual recreation of their internal structure, allowing doctors to understand their condition precisely and directly, thus able to perform surgery in higher successful rate. As a 3D printing technology company in process of proprietary intellectual property rights, ProtoFab offers more possibilities for future medical treatment. Patients with esophageal cervical spondylosis. The air duct might be blocked due to centrum hyperosteogeny that leads to osteophyte formation. Thus, it has a potential possibility that affects tracheal intubation conducted by anesthetist before an operation, which can be life-threatening to patients. Therefore, 3D printing provides the most effective guidance for doctors before surgery since it can replicate actual condition of patients. ProtoFab design department used the mimics to reverse the heart to understand X-ray data provided by Peking University Third Hospital into a completely easy-to-read 3D graphic. Currently, ProtoFab printing base has more than 30 intelligent SLA 600 printers, able to import, program, and print out cervical vertebrate 3D image files. Doctors can review and confirm patient surgery planning by performing simulated surgery on cervical vertebrate model, greatly improved safety and reliability during operation. With precision model printout through 3D printing as a precaution, some complicated surgeries will no longer be unpredictable and life-threatening. ProtoFab 3D printing company is piloting their technology in 4 China hospitals, such as Hunan Shangyang Hospital, further developing the 3D bioprinting technology. In the future, patients will be benefited by high-tech professional medical services aided by such technology.